Hello, my name is Alicia Dent, and I'd like to welcome you to the Genentech virtual field trip. If you're watching this, it's because we hosted this event in conjunction with the WonderWise Foundation. And so we provided some background for you about Genentech. And in some separate videos, we've also provided basically how your different pathways to Genentech and also career journeys by different Genentech employees. So in this video, I'll give you an introduction of Genentech and what we do. So this was the agenda the day of the event. The career journey session 1 and 2 are now separate videos that you can access and watch separate Genentech employees as they walk you through their pathways. There will obviously not be a 10-minute break. And then my colleague, Danielle Mandikian, will walk you through pathways to Genentech. So in this initial video, I'd like to play from Cynthia Burks, who is the Chief People and Culture Officer here at Genentech.
Hello, everyone. Welcome, and thank you for joining us today. My name is Cynthia Burks, and I am the Chief People and Culture Officer here at Genentech. What that means is that I oversee everything related to the wonderful people that we have here and the amazing culture here at Genentech. Before we start talking about Genentech, I really want to first applaud you for attending this event and investing in your future. It's really important that you own your developments and you own your future. You know, growing up, I didn't really have people in my life who could give me guidance around careers. I was the first person in my family to attend and graduate from college, and although my parents really encouraged my education and supported me, they weren't really able to help me figure out what to do with my background or with my education. And so it was events like these that I attended when I was in college and in high school that helped me to start thinking about what could be possible and what I might do. So as you attend our event, I invite you to explore the biotech industry as you think about your future. There's so many facets to our business, and I'm confident that you can have a very challenging, enjoyable, and rewarding career. And what makes that even better is that you'd be in the business of improving people's lives. You know, it's hard to get much better than that. I've been with Genentech for over 10 years now, and what keeps me at Genentech really is our amazing people and the impact that we have on both patients and society. For example, the photo that you're looking at is from 2011. We set a Guinness World Record for creating the largest human DNA helix with more than 2,600 people. I love this photo because it illustrates the fun-loving culture that we have here at Genentech and our commitment to being trailblazers. And so over the next few minutes, I'm going to share more about Genentech, what we stand for, the types of careers that we have, really for people like you with a variety of skills, interests, and passions. So what is Genentech? Well, Genentech is a biotechnology company that makes life-changing medicine to help people with serious diseases like cancer, like diabetes. We like to think of ourselves as original risk takers and change makers, people who are committed to challenging the scientific status quo so we can solve the world's most complex health challenges. You know, the story of our beginning is so interesting, and it started with two people. Two people with very different backgrounds and styles got together to talk about a new idea, biotechnology. Bob Swanser, who was a prominent investor, called a researcher, Herb Boyer, to discuss his role in the invention of recombinant DNA technology, which is really the foundation of biotechnology. This process creates new genetic combinations to help scientists create medical solutions that better treat and combat serious viruses and diseases. Now, what's amazing about this is that after just one meeting, Genentech was born, and the whole biotech industry was launched. An industry that now encompasses upwards of 1 million people, 1 million employees worldwide. And I love this story because to me, this is about bringing diverse perspectives together to create new ideas. We can see what happens through this example when we bring different ideas and perspectives to create something new. So today, Genentech employs more than 10,000 team members here on our campus in South San Francisco, a place that we've called home for more than 40 years. But we also have employees across the country in our commercial organization and at some of our manufacturing sites in other parts of California and Oregon. Since 2009, we've also been a member of the Roche Group. And Roche is a pharmaceutical and biotechnology company that builds medicines and diagnostic tests to help millions of patients globally. Roche was one of the first companies to bring targeted treatments to patients and is considered a leader in personalized healthcare. As the largest biotechnology company in the world and headquartered in Basel, Switzerland, Roche employs nearly 98,000 employees across 100 countries worldwide. What exactly is biotechnology? Well, biotechnology is the use of living systems and organisms to make products that improve our lives and the health of the planet. Think about your biology class. You've learned about what cells are made of and how organisms evolve to adapt to their environment. Well, biotechnology takes all of that one step further and asks, how can we use technology and science to make these cells and organisms work better for our planet and human health? Now, we've used this technology to do amazing things. And we at Genentech have been first to achieve a number of advances. This includes cloning human insulin, or making a synthetic version in the lab to treat patients living with diabetes, and a number of firsts to address serious medical conditions like Alzheimer's, cancer, heart attack, and strokes. To date, our medicines have helped improve the lives of more than 29 million patients worldwide. And we estimate that more than 7,000 patients are helped by our medicines every single hour. That's really something. One of the things that I do really enjoy about being at Genentech is the opportunity that all of our employees have to get to know our patients and to hear their stories. One of these patients is Harvey, you see him pictured here in the slide, who shared how one of our medicines positively impacted his life. You know, it's through these patient stories that we really understand the impact that our work has on others. So how do we do all of this? Well, it's the people at Genentech that are responsible for the important work we do, creating life-changing medicines to help people with serious disease. But contrary to what you might think, Genentech is not all scientists. In fact, only about 10% of our employees at Genentech are scientists working in the lab. We hire and develop employees with a wide range of skills and expertise, including fields like communications, computer science, engineering, finance, law, and human resources, which is the area that I'm in. And we use all of these individuals to help really get our product and our medicines to patients. And there are several steps and people involved between identifying a solution and producing a medicine so patients like Harvey have access. Starting with the discovery of a cell, to the development, manufacturing, and ultimate distribution of a medicine to the patients that need it. Our process includes more than scientists. We need team members to help produce the medicine safely and consistently, communicate its benefits to the general public, and certainly transport it to the right people and places. So you can see so many people are involved. As you can see, to produce life-changing medicine and improve the lives of all patients, we need to be more than just another biotech company. Being more starts with our commitment to creating an inclusive and diverse work environment where everyone can do their best work, being a leader in the industry, advancing health equity and inclusion in clinical trials, and positively impacting our communities. Inspirational people, scientific discoveries, and a commitment to society have shaped who we are and what we stand for today. But our work is far from over. We know that if we want to solve the world's most complex health challenges and build a healthier and more inclusive world, we need people like you. People who aren't satisfied with the status quo, who are excited about what science and medicine can accomplish, and who believe wholeheartedly that people of all backgrounds deserve excellent health and well-being. I hope you enjoyed learning more about us, and we really encourage you to keep up with the amazing things that we're doing and follow us on our channels. Enjoy. Hello, everyone.
So if you are not already inspired by Cynthia Burks, I wanted to highlight the amount of drugs that we were able to deliver to patients over the last few decades between Genentech and Roche. So each one of these markers indicates an FDA approval from either Genentech or at the top or Roche at the bottom. And so I want to highlight that Genentech actually is a part of Roche, and we work together to deliver quite a few different therapeutics for a lot of different diseases. And so, for instance, Tamiflu, which we brought to market in '99 from Roche, is used to treat the flu. Xolair, which is a product of Genentech, was brought to market in 2003, and that's used to treat asthma. There's Ocrevus, which is used to targeted therapy for specific cancers. And then you have, Gavreto, which is also, Ocrevus is actually for multiple sclerosis, and Gavreto, which is used to a targeted therapy for specific cancers. And so there's a number of these drugs here, and what really these markers indicate a tremendous amount of work from a diverse workforce that's, able to bring a lot of these drugs from the bench, so from discovery to benchside, so to the patients. And I want to then show you a video of how these drugs are, come to fruition.
A lot of innovations in Genentech start with our question, what if? Or what do you think of this idea? What if we did this? It'd be pretty cool if we could do this. And then every now and then, people get serious about it and say, let's go do this.
If you just talk about the general influenza that the majority of the population gets every year, you get the sniffles, you feel horrible for 3 days, and then you're back to work. We're trying to develop a therapy to treat those people that are most susceptible to developing severe influenza that's life-threatening.
What the virus is trying to do is turn the cell into a factory to make more viruses.
Anytime we make a neutralizing antibody, the flu has to evolve in order to evade our immune response.
Fortunately for us, there are parts of the virus that remain the same.
Highly conserved epitopes, regions that are extremely important to the virus and can't readily change to evade the immune system. Hemagglutinin is one of the most critical proteins of the influenza virus. We found what we believe to be an epitope on the hemagglutinin surface that could be targeted by a single antibody, such that antibody may be able to neutralize all circulating influenza strains.
We theorize that there are some antibodies within us that probably recognize all the flu strains we've been exposed to over many, many years. So that cell that makes that particular antibody, which is called the B cell, should be circulating within all of us. The trick was to find it.
So what we were able to do here at Genentech was vaccinate volunteers with a seasonal influenza vaccine that contains 2 different hemagglutinin subtypes. Then we would ask them to come back and donate those antibody-producing cells in their circulating blood. These cell types don't live very long, so it was critical that we get the samples directly to the lab within just a few minutes of collection.
The second challenge was actually trying to come up with a method to be able to look at millions of individual cells. We would be in this fax room, all of us staring at the screen.
You've got millions of cells popping up down here that we don't want, and the fax sorter is just shooting those cells to the trash. And then you would see a little dot appear in this very special quadrant that meant the cell was stained with 2 different hemagglutinin subtypes. You would hear the fax sorter, and that meant that the cell had been shunted into a single well of a 96-well plate. And we knew we got another cell. As soon as that plate was full, though, then the work began again.
So now we run it down the hill to my lab.
Because sometimes we had like a bucket brigade where we'd meet halfway and pass off plates.
All right, it was vital that we start cloning these genes immediately. So we would typically clone from 500 cells. But you can never get that from a human because each B cell is different. We really hadn't worked out the technology to clone single cells, which you can easily misplace.
One of Jerry's really close colleagues was able to spin that single cell down to where it would stick on the bottom of that plate. She would pull off that liquid and then wash the cell once, spin him down again. He would stick in the bottom. She would somehow really carefully go in and aspirate that liquid off.
And then we add the reagents, and now we have the DNA isolated for those genes.
That was an amazing feat, and they were able to clone these antibodies from single cells many times over. But we couldn't celebrate just yet because we needed to test if these antibodies were functional. Once we found those antibodies that could bind hemagglutinin and neutralize the flu viruses in the laboratory, that's when we could truly start to celebrate. We hope that the information contained within these antibodies could eventually lead to the discovery of the universal flu vaccine that would protect all individuals from both seasonal and future pandemic influenza outbreaks.
This work has created a new major platform for antibody discovery.
We can find many antibodies, and from those choose the ones with the best properties.
And we're able to do this in a very short time frame. It's going to help us in many other disease fields where we try to meet unmet medical needs. A lot of innovations in genetics start with a question, what if?
So that was just a snapshot of what it takes to get a specific drug, developed and, from the bench and then, down the pipeline. And so the division within Genentech that allows us to do drug discovery is called the Genentech Research and Early Development Team, GRED here. And these teams discover and develop therapies from the bench all the way to patients or bedside. And so there are three different ways in which this type of research falls into these different buckets. So with research, there's the biological insight and target discovery. So you have to think about a disease that you're interested in. And then you need to do some research to figure out, okay, well, what is an aspect of this disease that we could potentially make a drug against? What is a specific target that we're looking for, and kind of do research around that target? Once you have the target, you can then go into drug discovery. So you then try to develop a drug against that specific target that will help to treat this specific disease. And so you go from that early research to development sciences. So you translate, scientific insights in drug development to deliver the right drug at the right dose and to the right patient. And the way that you're going to do that is to then look at preclinical assessment. So you're going to take this drug that you formulated for a specific target, and then you're going to put it into your preclinical models where you test it to look at how effective this drug is. Once you look at the efficacy, then you can go into the clinical studies where you put them into patients, and then you can assess, okay, well, is this safe in a patient? Does it treat the patient in the way that we hope? Is this the right drug? Is it the right dose? Is this the right patient? And so there's a variety of skills and talents that need to come together in this community for this drug to go through this entire pipeline. And so I want to emphasize again that Genentech works on multiple pipelines, meaning we work on multiple diseases. We have a variety of things going on simultaneously. And so we work on oncology projects, so that's cancer, ophthalmology, so drugs that deliver therapies to the eye, immunology, so this has to do with autoimmune diseases like rheumatoid arthritis, neurodegenerative diseases like Alzheimer's, metabolic syndrome, so that would be like hypertension or high blood pressure, and then infectious diseases such as bacteria and viruses. And so here we have a patient story about how a Genentech or Roche drug has affected her and improved her life and health and well-being.
My name is Janet Ramirez. I am a registered nurse, and I work in the ICU. I have been wearing glasses since I was age 7, and each year my eyes have been getting worse, and so it's been quite challenging. So I have myopic CMV. It's caused by being so terribly nearsighted the shape of my eye. is basically really stretched. And so it causes the blood vessels in the back of my eye to bleed. And I see distorted things. I see blurry black spots. It's like a puzzle and you're missing a piece of it. You're seeing a picture, but you just have this one piece that just is missing, and you don't have it, and you're looking at it. I woke up one day and my vision in my right eye was distorted. I was actually watching television, and there was a black spot on the TV, and I thought it could have been something else. Thought it was the TV until I looked away. I looked at the wall, and the black spot was still there. It was following me everywhere I looked, and that's when I immediately called my doctor. I got diagnosed in 2012. Since then, I've been seeing a specialist, and he takes care of it with medication, keeping close eyes on it. If it was left untreated, I run the risk of losing my vision, because the vessels could continually bleed, or there could be other vessels that continue to bleed, that could possibly start bleeding and continue. Then that would obstruct my vision, and I could potentially go blind. When I first found out that I had MCNV, I was really shocked.
I think that's a scary thing to find out. You're putting in your eyes. Even as a healthcare professional, it's just like shocking. Because you just don't expect to hear that.
My first treatment was when the same day the bleed happened. It's a medication that gets injected into my eye, and it has significantly helped. In fact, it actually resolves the issues that I have in my eyes. The distorted vision eventually goes away. That black spots that I see, they get smaller and smaller until they just disappear, and then my vision is restored. If I met somebody that was working on making the medication, I would thank them. I mean, thank you for your research. Thank you for developing such an amazing medication to help people with my condition. I think they're doing amazing work. The fact that I have firsthand experienced it is amazing. I strongly believe in medications that help people. Being a healthcare professional, I see medications help people all the time, every day. And to actually have a company that's produced something that I actually need, it just blows me away. I love them for it.
So that was a very heartwarming story from Janet about a product that she is using from Genentech. And so with that, the career journey session they are available in a separate video. So we have employees that have recorded their session, and you're able to access that separately. In addition, since you're not able to physically go to campus and see Genentech, the last thing I'm going to show you is just a tour of campus via drone. And with that, thank you for watching. And if you want to see, again, the career journey slides or any of the Genentech employees talk about the career paths, those are in separate videos, as well as Danielle Mandikian will be talking about pathways to Genentech and different ways that you can intern here or work here in different capacities beyond high school. Thank you for your time. And I hope you enjoyed the introduction to Genentech and that you learned a lot, and good luck.
Hi, my name is Danielle Mandikian, and I'm a senior scientist at Genentech. And my journey to get here is definitely a little windy and twisty and not what you would always expect. So I was born in 1984, and I was raised in Texas. And my family is an interesting mix from two different cultures. My dad is an Armenian immigrant from Lebanon, and my mom is a cute little cowgirl from the farm in Texas. And basically, I was pretty mischievous from the start, and this was the cutest face I would make as a child. So my parents were a little bit worried, needless to say. And while I was in school, I actually kind of hated school for the most part. I was only really into, kind of doing hands-on stuff. And so when I was in high school, I took a lot of classes that were trade education based. So I did woodworking, auto tech, and metal fabrication. And so my favorite things to do when I was in school was welding and taking apart transmissions. And ironically, when I was in school, I actually almost flunked out of chemistry, but don't tell anybody. Eventually, in 2003, I graduated from high school, and you can see that I was still kind of a little punk, and I was clearly in a phase. But I was able to graduate, and I started college at a city college. Considering the fact that I didn't do that great in high school, I wasn't really into school to begin with, and I actually fought against my family pretty heavily because I wanted to, stick with trades. I enjoyed working with my hands, but my family was pretty persistent, especially coming from my father's side, who really struggled as an immigrant in the United States. And so eventually I started off school at City College. And when I was there, I did not magically start liking school, but somebody had abandoned a microscope at the college, and I spent a lot of time trying to fix it, obviously, because I like to take stuff apart. And in the course of doing that, I met a professor who really kind of got me on track with liking school, because he kind of took one look at me and said, I really think you would enjoy doing research. And he was right. After meeting him and trying to get into, thinking about taking apart like cars and how things work, I started getting introduced into cell biology and chemistry from that perspective, and my love for it just took off. So while I was still at the community college, that same professor helped me find my first internship. And so I went to work for NASA Ames down in the San Jose area on the Moffett military base, if any of you are familiar with it. And when I was there, what I did was I worked in the Center for Nanotechnology. And what we were doing is we were trying to create these little chips that you could implant into someone's brain. And part of those chips would like stimulate neurons to talk to each other. And the other part of the chip would like listen to everything that was said and kind of like fine tune how loudly the cells talked. And so I ended up doing that for 2 summers consecutively, and I absolutely loved it. However, the third summer, because I did not take a traditional career path, it took me 3 years at City College before I was ready to transfer. I also got an internship at the National Institute of Health, and that was a really cool experience, because what we were doing is we were taking viruses and using them to reprogram people's spit glands. And the idea was that, there's a lot of diseases where the reason there's a disease is because you don't have a certain protein in your body. So the idea was that we would use these viruses. Every time I talk about it, it makes me spit more. But like, we would use these viruses to attack salivary glands so that those glands that produce the spit would actually produce the protein that was missing and therefore be used as like a gene therapy. And so that was a fantastic experience from a city college and the connections that were made during that time. And one thing that I think is kind of important to note is that like my parents weren't educated, right? Like my dad, questionable whether or not he ever actually finished high school. We never talk about it. He like refused to talk about it. My mom only graduated high school. So they weren't able to help me, you know, figure out how to navigate things. The real support came from like from a professional sense, came from meeting teachers and talking to people and taking risk to do things where I felt like, oh my gosh, there's no way I'm smart enough to go hang out with people at NASA or NIH. But in doing so and stepping out of my comfort zone, that's where I really learned a lot, and it set me up in a really great way at school. And those internships I did also helped me whenever I transferred to UC Davis to finish my bachelor's. And while I was there, of course, because I got bit by the research bug, I started like stalking teachers on campus, and I found this one professor that studied cell division, and I was like hooked. I was super into it. We would look at basically all these different kind of mini machines, if you will, for a cell to, in order to like multiply and divide, there has to be like equipment that allows you to sort different parts of the cell and actually divide the cell properly. And so I kind of feel like my early career really started with auto tech, where I found, you know, in welding and fabrication, where I really found a love for understanding how all these little bits work together, and it easily translated to biology. I just needed that professor to help me see how. So while I was finishing up my degree at UC Davis, I was able to do undergraduate research within Dr. Kaplan's lab at studying mitosis, and I was able to graduate with my bachelor's in science. And my degree was in biochemistry and molecular biology, which again is hilarious considering I pretty much flunked chemistry in high school. But sometimes you just need to be in the right situation and find the right teachers. And again, I was the first person in my family to actually go to school, so it was a good feeling, but definitely difficult trying to figure out how to navigate it when you can't just follow exactly what your parents did. It's always hard to branch out, whether it's science or anything else for that matter. So when I finished in 2008, I stayed at UC Davis because I was so in love with figuring out how do cells divide. There was this other scientist that still studied cell division, but in a different way. He was studying a different kind. He was studying the division of specifically meiosis, which is pretty much how you get, like, you know, the cells that come together to create, you know, life. And I was so sure that that was what I was going to study in grad school. But what was really interesting is that I did, you know, when you start graduate school, you get a chance to learn and do what's called rotations, where you get to go to different people's labs and study different things. And you may think when I'm sitting here spouting out, oh, I did this internship, I did that internship, that I got to see everything and know everything. But the fact is, science and research is so vast that sometimes it's really hard to know what you're going to like until you get the proper exposure. So in grad school, when I did my rotations, I ended up really falling in love with some projects focusing on ion channels in neurobiology. So these are little proteins that are kind of responsible for neurons being able to communicate with each other. So it's almost like it took me many years to get down. I started off in nanotechnology, figuring out how to physically force these cells to communicate. And then when I was in grad school, I looked at a much deeper level to understand how are they communicating. And during that time, I was also very lucky because I got to do this exchange program for scientists. And I went and worked in Japan for quite a while, for about, like, I think 4 or 5 months. It was a while. And I got to train under this super famous guy who taught me how to take these really specialized pictures of neurons to really see at a molecule level, like, what's happening. And it was a wonderful experience. But during all of this, if that didn't sound like I was busy enough, when I got to grad school, I really got into doing community service. I had an uncle who was really adamant about always being a part of your community. And he kind of was my inspiration for always wanting to do volunteer work. But because of some of the experiences I had when I was in high school, and without getting into too much details, also with some of my friends and the community that I grew up in, I was really interested in helping out with children, especially children that aren't getting the right kinds of resources. And so I started working with foster kids when I was still in grad school, which was extremely rewarding. And there's lots of different ways that I was involved in it, but that was a big part of my life while I was also studying science. But in 2013, I graduated with my PhD, also in biochemistry and molecular biology, and that's me locked in a deli case that was super disgusting and moldy. And my lab mates let me out, but not before catching some photos where they caught me locking my own self into a fridge. But following graduation, it's kind of interesting, like sometimes, and maybe you guys who are still in high school can understand and relate to this, like you don't really always know what all options you have. And even as you go through your career, your view of what you're capable of is always like constantly changing, and you're constantly adding to it. And so like, I was really into research, and I thought that the only thing that I was ever going to be happy doing is like research in some dusty lab at a university. And that was like the only type of experience I would have. And unfortunately, when I was finishing up my PhD, I had planned to follow that same professor from Japan for my postdoc, which is kind of like this extra training that you do after you finish your PhD. And it kind of preps you up to be like super professional and know how to like run a lab and like really kick through stuff. But the like week I was giving my defense, which is kind of like one of the last steps you get to get your PhD, I found out that my dad was terminally ill. And so I had to kiss like moving goodbye away, just because like it was not going to be a practical balance with my career goal, as well as like, the thing that matters to me most, which is my family. And the reason that I share that isn't for like, oh, let me tell you about something sad. It's just that, life happens. And one thing that I think is really critical for why I'm happy with whatever pathway it is that I'm on is I think I've always had this perspective that you don't always know what tomorrow is going to bring, and you don't know what opportunities are going to come up because of them, like whatever events occurred, good or bad. So it was really tragic that my dad got sick. And at the time, it kind of felt bad that I wasn't going to go do this like global project, where I get to leave and go somewhere foreign and like live there and do this amazing research that I was excited about. And what ended up happening is that forced me, because of financial reasons, to help my dad pay for bills, it forced me to reconsider industry. And it wasn't anything that had ever been on my mind. But luckily, I got into a really great lab at Genentech back in 2014, right before my dad passed away. And that actually allowed me to be able to financially support my family whenever we really needed it. But the other thing that happened from that, besides the financial side, is that allowed me to find a way to explore my research interests in a totally different setting. And what I really like about it, especially, and this was something that really hit home to me because I was watching my dad get sick and die, right? One thing that was really important to me is understanding that when I went to work, I knew that whatever it is I was working on isn't something that's necessarily going to be a textbook chapter, but it's something that's going to change someone's life now. And a lot of the stuff that I work on ended up, even though I started off kind of thinking about neuroscience, cancer, back to neuroscience. Now that I'm at Genentech, I focus a lot on cancer, and it's a very personal thing for me because that's how I lost my dad. And it feels really good to know that every day that I go to work and I give my everything that I have to give for it, I'm also able to try to hopefully impact somebody else's life, because there's so many people that are affected by cancer. And so again, that's just another example of, you don't always know what your path is going to be, but even when life happens, some things that feel, not great can still provide these amazing opportunities. And the other thing that I really enjoy about my job, besides, obviously being able to work on a disease that really impacted my own personal life, is that I've been able to continue my my passion for social services. And so after I finished with my PhD, I still work with foster youth, but I started as a court-appointed special advocate. And that was something that was really amazing, because that allowed me to impact foster youth at a legal level. And maybe you guys don't know what that is, but ACASA is this program where you get partnered up with kids that are in the system, and you actually get to go to court and fight for them. And you end up getting to, really build close relationships with youth and make sure that they're properly taken care of, no matter where they go in the system. And that's actually how I met my daughter, who I ended up adopting. So I guess what I want to say is that, as you guys are thinking about whatever career journey you're going to take, always keep an open mind, because you never know what opportunities are going to come up before you, because how could you? You haven't been exposed to the opportunities that are available yet. And the other thing I'd like to say is that take those risks, because going outside of your comfort zone, it's not so much about, like when I went to NASA, I didn't get a publication out of it or something like that. I didn't get some big award, but being able to go outside of my comfort zone and work in a place where I felt intimidated helped me grow in ways that I still to this day have a hard time trying to communicate to people. You know what I mean? And it's the same thing with volunteer work, like who you are as a person, your passions, your interests professionally, and your family life. All of these things are going to be the things that come together to help you make your decision. And being open and listening to each of those things will still guide you in a really great way. The other thing, the last kind of closing remark, is a lot of this journey for me started by an interaction with one teacher, Dr. Kawagoe, the guy that was at the city college who was like, you need to do research. And then he connected me with other people. And even though a lot of you will probably have great family members who are going to be able to support you, unless they are doing exactly what you're trying to do, they may not be the people that can provide that pathway for you for your career. So it's really important to reach out to people that are in the profession that you'd like to pursue, because they'll be able to help you in ways that you may not even understand from now. And it definitely pays off. So that's how I got to where I am, and thanks for taking the time.
Hi, my name is Chris Davies, and I would like to share just my career journey with you. First, let me get a laser pointer and kind of walk you through this. So I was born in 1986, and so that will put my age at 34. So I was born in Kentucky. So Kentucky's known for the Kentucky Derby, bourbon trails, a lot of kind of outdoors, kind of depending on what part of Kentucky. So I was actually born in Bowling Green, Kentucky, which known fact is that Corvettes are made here. So you got the Corvette Museum, Corvette Factory. But then I grew up in Frankfort, which is actually the capital of Kentucky. So it's not on the map. So Frankfort is right here in the middle between Lexington and Louisville. And then I went to finish the last 3 years of high school in Lexington, Kentucky, as you can see here. So I graduated from Lexington Catholic High School in 2004. So the last 3 years of high school, I went to a private school, which was about 30 minutes away. But up until this point, I'd gone to public school my whole life. And so part of the transition, I was able to play soccer in high school. And so my junior and senior years made it to 2 state Final Fours, which is kind of super exciting from a soccer standpoint. And that really helped kind of, not only cultivate my skills on the field as a soccer player, but, very good academically, and really helped me to kind of propel going forward. And so after high school, I went to college at Western Kentucky University. And here, I majored in chemistry and mathematics, but I also was a Division I soccer player. So I got to be able to balance the two together, doing hardcore sciences in the STEM, but also playing soccer. And so here I really learned about balance in my life, because I knew if I wanted to continue to stay on the field, I needed to do well in the classroom. And long-term, I needed to do well in classroom for, going forward career-wise. And so after my junior year in college, I got an opportunity to go down to Atlanta for a summer, and I did an internship at the Center for Disease Control, which is, the CDC is probably one of the biggest names and topics that are on the forefront of news and people's minds now with the pandemic. So I was there after my junior year doing an internship. So it was pretty cool. I was 20 years old living in Atlanta. I was down there with my best friend, but I also got to, further advance my career. And then going back to finish my senior year at Western. And then after I graduated in 2008, the summer of 2008, I went back to CDC to do a second summer internship, which was, again, really exciting opportunity. And so at my internship, my boss that was on there really encouraged me to really start thinking about grad schools and going to get my PhD. And so if it wasn't for doing that internship, I don't know that I would have gone off to grad school, or at least grad school in the capacity that I did, to pursue my PhD. And so through that, I applied, got into Purdue University, and started in the fall of 2008 my PhD in the chemistry department. And so my main focus was doing biochemistry, kind of working with proteins, protein interactions, and things like that. And so after 5 years, so 2013, so from 2008 to 2013, I was at Purdue, and I graduated with my PhD in chemistry. And that opened the doors for me to move out west. And so in 2013, I moved out west, out to here, to the Bay Area, which I actually live in Oakland, to do a postdoc at UC Berkeley. And, at the time, I would say my decision to come out west was a life decision. I didn't know, I knew one person out here at West. My family's 2,000 miles away. My family's from Kentucky, as I presented earlier, so I didn't know anybody. But at 26, I had a PhD, and I was ready for an adventure. And coming to Berkeley wasn't going to hinder my career. If anything, give me an opportunity. But at the end of the day, if it didn't work out, I knew I could just go back. And so I think in this lesson, really to kind of say, just step out and just be adventurous, right? And, I think you make calculated decisions and things like that, right? But, it was an opportunity to move across country to kind of broaden my horizons in life, as well as career-wise. And so I jumped on it, and I did that. And, so I was a postdoc at UC Berkeley for 2 years. It was a very good experience. I grew as a scientist, but also grew as a person, just to learn a new environment, an environment that's very, very different from the Midwest. And as you can see now, being here at Genentech, it's a staple of me staying out here. So I've been out here since, this year, 2021 would be 8 years. But after 2 years at Berkeley, I transitioned to my current job at Genentech. And we're here, I get to do awesome science, both to discover new medicines to really help patients, but I also get to do really cool science just for kind of a research, kind of exploratory applications, which is also really fun. And so yeah, it's, I think, a couple takeaways, right? Like going from Kentucky out to the Bay Area, right? I never would imagine of that journey in itself, but I think being bold, being excited, being curious, I think are the things that would really describe my career journey to where I'm at now. So thank you very much, and I'm glad the opportunity to just be able to share just kind of how I've gotten to where I am today.
Hi, everyone. Thanks so much for coming on this virtual field trip to Genentech. We're really excited to have you, and we're really excited to share some of what we do with you. So my name is Maddie Ramos, and I'm a scientific researcher here at Genentech. And before I get into what it means to be a scientific researcher, I wanted to share a little bit about my journey here to Genentech. So I'm currently 26 years old, which means I was born in 1994 here in the Bay Area. And I grew up in both Vallejo, which is kind of the East Bay area, as well as here in San Francisco. I was the youngest of four, and I have one brother and two stepsisters. And when I was young, I was very, very involved in sports. That was kind of my whole life. And, I played baseball, softball, soccer, volleyball. I kind of did a little bit of everything. And so, once I got to high school, my family had moved out to this little town called American Canyon, which is up by Napa. And so I went to a small high school in the Napa Valley area, and I graduated high school in 2012. And so since neither of my parents went to college, it really wasn't until kind of like, early high school time that I started thinking about college and what I wanted to study and what I wanted to do as a career. But since I'm the youngest in my family, I had the really nice opportunity to watch my older siblings kind of go through the college admissions process. And so I was able to learn how to navigate that from watching them. And so, when I was thinking about kind of what I wanted to do, I was thinking about how my favorite class when I was in high school was human anatomy and physiology. And I loved this class so much that I took it twice, once as a regular student and once as a teaching assistant. And, when I think back on it, I remember it being one of the few subjects that like really genuinely held my interest and made me curious to kind of learn more beyond what we were learning just in the classroom. And so I took that as a sign that maybe I should choose a major that kind of had something to do with that subject matter. And so, naturally that would have been science. So at the time I knew I didn't really want to be, a doctor or any sort of clinician. But for some reason, I knew I didn't want to do that, but I never really considered a career as a scientist. At the time I didn't really know anyone who was working as a scientist or had pursued a career in science. So I didn't really think of it as a viable career path. But after my brother had graduated high school, he went on to study engineering. And just like the true younger sibling that I am, I decided to copy him. And so, I did a little bit of Google searching and I was like, okay, I think I might want to do engineering. How can I kind of combine that with science? And from that, I learned about something called biomedical engineering, which is, kind of a good combination of classical engineering, but also applied to science. And so, I thought that's a perfect combination. Let's go with that. And so after I graduated high school, I ended up attending Cal Poly in San Luis Obispo, which is located on the central coast of California, so kind of halfway between San Francisco and LA. And I chose this school for a couple different reasons. One, because my brother was going there, and as I've already told you guys, I'm a huge copycat. And number two, I had talked to my college counselors and they said, if you're interested in engineering, this is a really great engineering school. We think that you would do well there. And so as a biomedical engineering major at Cal Poly, I learned a lot about the basics of mechanical engineering and how to apply those to biological problems. And so in my program, we mostly focused on how to make medical devices, which is a really common application of an engineering degree that's kind of focused in the biological sciences. And so I spent a lot of my time in college learning about that kind of subject. However, when I got towards the end of my college career, so maybe around, a year and a half before I was getting ready to graduate, I had started to feel a little bit kind of uninterested or just not as excited about the engineering as I was before. And I found myself, wanting to learn more about just science instead of the engineering, and just found myself more interested in that kind of, how I felt in high school. And so my last year and a half, I really kind of dove into the science-heavy classes, and I found myself, thriving again in classes like physiology, pathology, organic chemistry, and biology. Like that, those were the classes that were, making me really excited and where I felt like I had a passion. But at that point, since I had spent so much time studying engineering and kind of applying that to medical devices, this is what, when I was getting ready to graduate, that's what I felt like I was most prepared to do and the most qualified for in terms of finding a job after college. And so when I graduated from Cal Poly in 2016, I entered the workforce, and my first job out of undergrad was as a manufacturing engineer at a company down in Southern California that was part of the medical device industry. And so the company I worked for specialized in creating surgical consoles that help a doctor perform eye surgery. And there's a picture of one of the consoles here that I worked on. And my job there was essentially to make sure that the manufacturing line was as streamlined and efficient as it could be, while still making high quality products. And so this job was really challenging in that, I had to know all of the different parts of this really complicated surgical module and understand what each of them did and how they fit together. And then when something went wrong in the console, it was also part of my job to try and figure out what the issue was and decide how best to resolve it. And so, this job was really challenging, but I think I knew early on that this wasn't really where I wanted to kind of build my career. While I was working there, I found myself asking a lot of questions about why the consoles were made this way and not just how they were made, which was kind of, more what my job description was. I wanted to know more about the anatomy of the eye, and I wanted to understand like how the surgeons were using this and what each of the surgeries entailed and that kind of stuff. And so, eventually, as I spent more time there, I really started to pay attention to the types of the questions I was asking. And I think from that, I really decided that, I think I want to be in research and development and not necessarily in manufacturing, which is kind of like, down further in the development process. And so, in addition to this, I think I had decided at this point that I really wanted to find a job that was just in research and development, but more of a science-based job versus an engineering-based job. But as I mentioned before, at this time I didn't feel like I was prepared or qualified for a scientist type job. I had done some lab work in college, obviously, like through my science classes, but I didn't have any internships in lab-based positions under my belt, and I didn't really have any mentors who were scientists who could kind of guide me in that industry. So I was feeling a little bit lost at this point. But, since I grew up here in the Bay Area, Genentech had always kind of been on my radar because I had some family friends who worked here in a non-science capacity, and I remember hearing from them that it was a great place to work and they really liked it. So I started looking more into Genentech, and that's when I discovered rotation programs. And so rotation programs are essentially training programs that are designed for people who are coming out of an undergrad or a master's and who want to work in this industry, but aren't exactly sure what role they want to have or, kind of where they want to start building their career. And so I applied and I was accepted into the Development Sciences Rotation Program, or DSRP, at Genentech in 2017. And so I didn't know it at the time, but the program was brand new, and I was actually going to be a part of the very first cohort. And so to give you a little bit more background on the DSRP, it's a 2-year-long program during which you do 4 6-month rotations in different departments within the Development Sciences organization, which is in the research and development group. And so I think, once I was accepted and I started this program, it was a really pivotal moment for me because it really opened my eyes to the world of science and how many different roles you can have within that. Before I told you that I felt like I didn't really qualify for a science job or wasn't prepared for it. And I had this kind of like limited view of what a scientist could be. But, going through my different rotations, this really helped me learn all of the different options that are open to working in science. And it allowed me to try some different things until I found something that really fit my interests and my skill set. And it also taught me a lot about being flexible and learning on the job. And then in addition to all of that, I was really fortunate that I got to meet a ton of different people as I was doing these different rotations. And some of who are mentors for me now, which is, something that I didn't really have in this industry before. And so having those mentors is really important, and they help me to navigate my career path and kind of push me to grow, which is really, really important. So after my 2 years in the DSRP had ended, I decided to stay here at Genentech, and I joined the lab full-time as a scientific researcher in 2019. And so I've been in this role for about 1.5 years now, and I really love it. And so, kind of when I was putting this together and looking back on my journey to Genentech, I realized that there were really, a number of pivotal moments for me that kind of got me to where I am today. And I think, my main advice for you guys would be to kind of maybe to pay attention to that little voice inside your brain, and really try to listen to yourself and to recognize, that sixth sense that you have and see where it takes you. Because I remember being back in high school and having no idea what I wanted to do with my life and feeling so scared that I would never figure out, what I felt passionate about. But, over the course of my career so far, I've found that, when you take the time to really notice the kinds of questions that you're asking or think about why you're making some of the decisions that you are, there's little clues there that can help you tease out what you're truly interested in. So now that I've told you a little bit about my journey here, I'd like to share a little bit about where I am now. So as a scientific researcher, I work in research and development here at Genentech, and I'm not sure how familiar you guys are with Genentech, but to put it simply, our main job here is to make medicines for patients with various diseases such as cancer, hemophilia, multiple sclerosis, Alzheimer's, a number of different things. And it takes a whole lot of people to be able to make these medicines. And so the group that I work in is called PKPD. And PKPD is a short way to say pharmacokinetics and pharmacodynamics, which are two really scary sounding words. And to be honest, I had no idea what they meant when I first got here. But, over time, I learned that a kind of a simple way to explain them is that PK, or pharmacokinetics, is determining what your body does to a medicine. And then PD, or pharmacodynamics, is determining what a medicine does to your body. And so this is important because when we make medicines, it's really critical to know a number of things, but these two in particular, one, does this medicine work? And two, why does it work? Or what is it changing in your body that's giving you the effect that's, helping with your disease? And so these are the kinds of questions that we answer in my group. And so to answer these questions, I do kind of three main things as part of my job. And so as a scientific researcher, a really big part of my job is to plan experiments alongside the scientists on my team. And so, we think about what questions we're wanting to answer, and, we think about what's the best way to design a good experiment to answer these questions clearly and concisely. And then once, we take the time and we have a good experiment designed, then I go to the lab and I execute the experiment and generate data. And so this is the really fun part for me because it means that I'm moving around and running instruments, and instead of just, sitting at a desk doing computer work, which can be really hard for me. So I really like being able to be up and moving in the lab. And so, once I've done the experiment, generated the data, then I move into kind of the last part of my job, which is to analyze that data and to determine the results from my experiment. And then once I've done that, I can bring these results to my team or to, whatever team that I happen to be working with at the time. And we can discuss, what those results mean in the context of our original questions. And then we can also use the data and the results to make decisions about how we should develop these medicines, or, if a medicine is worth developing further or not. And so, my whole wide group focuses on PK/PD, but my specific team is kind of more focused on PK, or the pharmacokinetic side. So more specifically, we use different techniques to understand how a drug or a medicine moves through the tissues in the body. And so this is important when we're developing medicine, because we need to know where the medicine is going after you take it and how long it stays in your body for. Because, these things can help us determine if a medicine is safe and also if it's working properly, which are, two really important things to know. And so to track a medicine within a body, we use a couple of different methods. And so one of these is SPECT/CT imaging, which is uses special cameras and x-rays to be able to image a medicine when it's inside of a body. And so the picture here is showing an example of a SPECT/CT scan of a mouse. And so the blue and green signal that you're seeing here, or the blue and green color, shows where the medicine is within this body. And if you look at this round part on the left side, that's a cancerous tumor. And so since we see green there, we know that there is a good amount of medicine going to this tumor, and that's where it's supposed to go. And it's, not necessarily going to many of the other organs where it could potentially cause harm. And so from this, we can say, we can make decisions about whether or not, this drug is working properly, or if we should keep developing it. And so another way that we track a medicine within the body is using tissue distribution studies, where we inject a medicine into an animal model and we collect different tissues from that animal to see where the medicine went and how much went there. And so one last way we track this is using microscopy. So doing this is really helpful because it can tell us not just which tissues the medicine is going to, but where within that tissue does the medicine go. So for example, the picture that's shown here is a cross-section of a tumor. And so the small round things that are blue are cells, and the stuff in red that you kind of see around the edges is the medicine. And so we can see here that, the medicine is going to the tumor because we see it in red in this cross section. But we can also see that, since the medicine is kind of like around the edges, it's not really getting into the core of the tumor. It's kind of hanging out around the edges versus kind of getting into the middle, so where all of those other cells are. And so that gives us some information about, how well the drug is working and what we can do to make it better. So overall, this is kind of what I do as a scientific researcher at Genentech. And if you guys have any questions for me, feel free to pass them along to your teacher, who can pass them along to our organizers here, and hopefully we can get you some answers. But thanks so much for taking the time to watch my presentation today, and I hope it was helpful for you guys in your career journeys. Thank you.
Hi, everyone. My name is Lynn von Bogdandy. I'm a program manager at Genentech, and I'm here to tell you my journey line to Genentech. I grew up in Massachusetts. I'm one of 4 children. I'm the second oldest. This is a picture of me on the left. This is a picture of me on the left with my 3 siblings. And where I grew up, there was a lot of space for me to play and explore a wooded area full of trees and bugs and animals that I was very curious about from a young age. So my love of science grew at a young age. And when I was in high school, I had the opportunity to study biology and loved that subject and did well in it. I got good grades in biology, and I always loved math as well, and chemistry and physics. And when I was thinking about what to study in college, I definitely wanted to study biology to some extent. And I was interested in helping people directly and interested in becoming a doctor someday. So that was a big interest of mine. So I applied to schools, and I got into Worcester Polytechnic Institute, which is strong in the sciences. And I studied biology and biotechnology there. And as part of the curriculum there were several projects we needed to complete in order to get our degrees and graduate. And one of these projects was to help society in general. And there was a project set up all the way in San Francisco, at San Francisco General Hospital, that was available for me to help San Francisco General Hospital understand how patients spend time with nurses and how much time nurses spend on patients, taking their pulse, doing an intake on them, which involved taking their pulse, taking their temperature and whatnot. And this was helpful for the hospital and what I chose to do for this project. And I was able to get on a plane for the first time in my life and travel from the East Coast, where Boston, Massachusetts is, to San Francisco. And I loved that opportunity. I learned a ton during the project and at San Francisco General Hospital, and I loved the opportunity to travel and to see another coast in this large country of ours. And I always thought I'd love to live out in California. After college, I needed to work. I had student loans I had to pay off. I also wanted independence from my parents. So I got a job right after I graduated college, and I worked initially at Boston University Medical School for about a year. I was a research associate there. I learned about proteins and how to isolate proteins and analyze them. And I also learned, as I networked with other people I knew in Boston, that there's an organization called the Howard Hughes Medical Institute, which was located at Massachusetts General Hospital, and they had a lot of research projects that were going on there that actually were very directly applicable to helping particular diseases. And I ended up applying to a job at Howard Hughes Medical Institute into a lab that studied diabetes, which was of great interest of mine. And I got a job there. And at this job, I was able to learn how to pipette on a regular basis, become really comfortable with that. I learned how to culture cells and mammalian cells or eukaryotic cells in culture, and how to transfect these cells with DNA and particular genes in order for the DNA, once it's within the cell, to express a protein, and how to isolate these proteins that were expressed from these cells. And so I learned a ton at this job of mine. And maybe most importantly, I learned how to work with a team of people, a team of scientists and research associates in order to get a project done. I also always had medical school in the back of my mind, and I believe I had applied to medical school and wasn't getting in. And then I decided I would think about moving to California, since California had several state medical schools that are more affordable than private medical schools. And I thought moving to California might be a good move for me. So I networked with my manager in Boston, and she referred me to a friend of hers at UCSF, where there was a Howard Hughes Medical Institute there. And I applied for a job at UCSF, Howard Hughes Medical Institute. I got a job, and I became a research associate there. And this allowed me the opportunity to move from Boston, Massachusetts, all the way to San Francisco, California. And I drove with all my life belongings with a a best friend of mine, she ended up, flying back to Boston after we got to San Francisco. So I moved out to California by myself and started my job at Howard Hughes Medical Institute at UCSF. And I loved that job. What we studied was in immunology and supporting the immune functioning of cells. And I love that job. I learned a lot, but I was still very interested in going to medical school and thinking about how I could improve my medical school application. And so I thought maybe if I also had experience working in the biotech field, that could be helpful. I had heard about a biotech company down the street in South San Francisco called Genentech at the time. And what I did was I networked with friends of mine in Boston. Someone knew someone who worked at Genentech, and I was able to pass my resume on to that person who worked at Genentech. And I was able to apply for a job, get a job interview, and then get hired at Genentech as a research associate there. And I loved that. It was quite a different experience going from academia, which is like working at a medical center like UCSF, and then going to a private company, a biotech company like Genentech was very different. There were a lot of resources. There were very, very collaborative people at Genentech who would help each other out. There were many opportunities to learn about different ways of doing things, different experiences, different experiments. And I loved that experience. Still wanted to go to medical school and needed to improve my application. So I took classes at San Francisco State University. One of these classes I remember well and loved is called Human Anatomy that I took at San Francisco State, and that was really interesting. And still was applying to medical school, wasn't able to get into medical school. And at this time, I decided I would pursue another strong interest of mine. So I not only believe in Western medicine as a real strong place to pursue a career, but I also believe in Eastern medicine, traditional Chinese medicine, and holistic medicine as another way to complement the way we can be treated for our health and enhance our health. So I decided, after not getting into traditional, medical school, Western medical school, that I would apply to Chinese medical school. And I got into a school that's in San Francisco called American College of Traditional Chinese Medicine. And I studied acupuncture and Chinese herbs, and I became a licensed acupuncturist. And I tried to start a practice right out of Chinese medical school after I got licensed, and I was not healthy at the time. I also was very poor. I needed to earn money to support myself in San Francisco. So I needed to go back to the corporate sector and get another job. I spoke to my old manager at Genentech, asked him for a reference, and he said, of course. And he also told me that he had an opening in his lab. I was able to apply for that job and get a job back at Genentech. And so I became a research associate at that time for the second time at Genentech. And I worked in the molecular oncology group, transfecting cells, expressing proteins, all with the hope of helping to develop drugs in cancer. And I loved that job. And I also learned that there's another career path at Genentech that I was not aware of, which was project coordinator, project manager role, where you can work with a cross-functional team of people and help support that team, and still, help develop drugs, but you're supporting the functionings of a team. I would gravitate towards roles like that. Whenever I was in the lab, I would like helping people with reagents and working with people directly. So I knew this might be a good path for me. So I ended up taking classes in project management at night at UC Berkeley Extension. I also was able to do an internship at Genentech, spending part of my time in a project management group for 6 months, getting hands-on training in project management. And I eventually was able to gain enough skills in project management to apply for a project manager job and get a role as a project manager at Genentech. And that's my current role at Genentech. And I've been a project manager for around 14, 15 years at Genentech. And I'm thrilled about that because I work with many different types of people on my teams from all over the world, from all different functions, from people who have biostatistic expertise, people who are clinicians, are medical doctors who help us understand what the diseases are. I work with people in finance, people in the legal realms, and all of this, the teams that I've been supporting help to develop therapeutics that can help different patient needs in the world, such as cancer, asthma, arthritis, for instance. And also being at Genentech, I have great opportunities to do some volunteer work, just like what I'm doing right now is like talking to you all about the opportunities at Genentech. So these are the types of things I love doing at Genentech. So now I'm going to turn to a slide that's going to talk to you about my role as a project manager. And recently my title has changed to a program manager. It's a very similar thing. So a typical day in my job, I work with the team leader on the team to plan agendas for our meetings. I write a summary for the meeting or write meeting minutes for the meeting so that we can track what was discussed, what is the next steps. I organize and distribute information. Generally, we put together websites for each of our project teams so the team can access documents when they need to, and they can find out where the meeting summaries are and get the information they needed. I also answer a lot of questions, whether it's through email or people call me or text, and I connect individuals with information they need or with people they need. So I think of my job as very much as like a bridge. So I may not have all the answers, but I can bridge people to the information that they need to get their job done. And my job is important because I keep information moving. I communicate what has been decided upon and what is the next priorities. And I also think the important role in my job is to really kind of hold space, bring people together so that they can generate ideas and make decisions. So I think of myself as someone who holds space for the team as well. And that's kind of my story of my journey line. I hope you found it inspiring, and I wish you the best of luck on your journey to your career. And bye for now.